Fallot is a birth defect that changes normal blood flow through a baby's heart. A healthy heart has 4 chambers: the right atrium and right ventricle, and the left atrium and left ventricle. After delivering oxygen to the body, oxygen-poor blood flows into the right atrium. When the right atrium contracts, it loads blood into the relaxed right ventricle. Then the right ventricle contracts, sending blood to the lungs through the pulmonary artery. The blood picks up oxygen in the lungs, then returns to the left atrium. The left atrium contracts, filling the relaxed left ventricle with blood. And the left ventricle contracts to pump and deliver oxygen-rich blood to the body through the aorta. Tetralogy of Fallot is a birth defect made up of 4 problems with the heart and its blood vessels. A ventricular septal defect, or VSD, is a hole in the wall between the 2 ventricles. The hole allows oxygen-rich blood to mix with oxygen-poor blood. An overriding aorta means the aorta is shifted slightly from its usual location on the heart. It sits right over the ventricular septal defect. This allows blood from both ventricles to flow through the aorta. As a result, some oxygen-poor blood may flow to the body. Pulmonary stenosis means that the main pulmonary artery is narrowed, and the pulmonary valve doesn't open all the way. As a result of the narrowing, less blood reaches the lungs. Right ventricular hypertrophy means the wall of the right ventricle is thicker than normal. This is thought to happen in response to blood flow through the ventricular septal defect, and from having to work harder to pump blood through the narrowed pulmonary artery, which results in increased blood pressure. Together, these 4 problems may prevent enough oxygen from reaching the baby's body. This may result in episodes of a condition called cyanosis, or blue baby. In this condition, the baby's skin, lips, and fingernails may have a bluish tint.
Your blood pressure can be measured with a blood pressure cuff called a sphygmomanometer. When your heart beats, the pressure of blood on the walls of your arteries is called systolic pressure. When your heart relaxes between beats, pressure on the artery wall is called diastolic pressure. Your blood pressure may change throughout the day. However, it should normally be less than 120 for systolic pressure, and for diastolic pressure, it should normally be less than 80. If your systolic pressure frequently stays above 140 or your diastolic pressure frequently stays above 90, you have high blood pressure. Your specific has been diagnosed with high cholesterol, it's important to understand what cholesterol is and why it's important to keep it under control. Cholesterol is a fat-like substance made by your liver and also comes from foods you intake that is then packaged into particles called lipoproteins. Your body needs cholesterol to make hormones, vitamin D, and a substance that helps you digest food called bile. This video discusses 2 types of lipoproteins that carry cholesterol: low-density lipoprotein, or LDL cholesterol, also known as bad cholesterol, and high-density lipoprotein, or HDL cholesterol, also known as good cholesterol. LDL travels through your bloodstream, delivering cholesterol to the cells that need it. If your body has too much LDL, it can build up in the walls of your arteries. LDL and other substances in your artery wall form a fatty deposit called plaque. Over time, plaque can narrow the artery and reduce blood flow. LDL carries cholesterol into the plaque. This is why LDL is called the bad cholesterol. A common place this plaque can build up is in your coronary arteries, which are the blood vessels that feed your heart. This plaque buildup causes coronary artery disease and increases your risk of a heart attack. Plaque buildup in other arteries, such as the carotid arteries in your neck, can reduce blood flow to your brain and increase the risk of a stroke. Your liver also makes high-density lipoprotein, or HDL, also known as the good cholesterol. HDL helps remove excess cholesterol from your cells, tissues, and from plaque in your blood vessels. This is why HDL is called the good cholesterol. HDL returns the excess cholesterol to your liver, which removes it from your body. If after viewing this information you have questions about cholesterol or any medications you've been prescribed to help manage your high cholesterol, speak with your healthcare provider. It is important to take your medications as directed by your provider. The oxygen and nutrients your body needs. The main pumping chamber of your heart is the left ventricle. When your left ventricle contracts, it sends oxygen-rich blood to your body through a large artery called the aorta. Connected to your aorta are small arteries called coronary arteries. Blood flows from your aorta through the coronary arteries to supply your heart muscle with oxygen and nutrients. During your heart attack, blood flow through one of your coronary arteries may have been severely reduced or completely blocked. Your reduced blood flow may have been caused by a buildup of a fatty substance called plaque in your coronary arteries. If this plaque became disrupted, a blood clot might form and severely worsen the narrowing, or lead to a sudden, complete blockage, stopping blood flow down the artery. A blockage in your coronary arteries prevented the oxygen and nutrients in your blood from reaching the part of your heart supplied by the artery. As a result, heart muscle in that area started to die. Damage to part of your heart muscle is called a heart attack. It's also known as a myocardial infarction, or MI. Your heart doctor may have recommended a procedure to help open the blockage and improve blood flow to the damaged area. The procedure you had may have been a coronary angioplasty. During a coronary angioplasty, a balloon-tipped catheter inflates inside your blocked coronary artery to open it. The procedure may have involved placing a stent to help prop the artery open. This is usually a thin metal mesh that acts as a scaffold. Or you may have had a coronary artery bypass graft, or CABG. CABG is a surgical procedure in which the blocked areas of the coronary arteries are bypassed with veins or other arteries from the body. Before you left the hospital, your healthcare provider most likely prescribed several medications. Your medication may include the following: oral antiplatelet therapy helps prevent platelets from sticking together and forming new blood clots. You may have also received drugs called beta blockers that help lower your heart rate and blood pressure. Drugs such as angiotensin-converting enzyme, or ACE inhibitors, angiotensin receptor blockers, or ARBs, and calcium channel blockers also work to lower your blood pressure if needed. And you may have been prescribed statins, along with a low-fat diet, to lower your cholesterol. These drugs work by reducing the amount of cholesterol made in your liver. It is important to stay on your medications as your physician prescribed, even if you are feeling better. Do not go off your medication unless the healthcare professional that prescribed them tells you to.